So, abortion rights advocates hoping to make it easier to end late term pregnancies have actually outsourced a drug trial to an impoverished African country.
Wow.
This is from Real Clear Investigations. And this is literally about a clinical trial that is being done in Burkina Faso. And many of you are familiar with Burkina Faso. It is one of the most impoverished areas of the continent of Africa. And this is where they subsequently decided to do a drug trial on women in this impoverished nation for drug induced abortions. And so I could probably just stop there and you'd be like, okay. But we're not. So what's actually happened is that we have talked about drug induced abortions on here before. We have talked about women that have tried to get access to them through mail. Being that's really where this is going, by the way, in this nation, is to get. It's the ability to get an abortion to a woman as quickly as possible without her actually having to see a physician. That's what they're after in this nation. Okay, I'm just letting everyone know that. And so, but here's the interesting part is that um, it says the outsourcing of the study, which began 2.5 years ago, 2.5 years ago, mind you, it appears to reflect the reluctance of American women to participate in such trials.
I
Okay.
wonder why.
I wonder why, right? And so it says 2013 bulletin from the American College of Obstetricians and Gynecologists acknowledged that they had failed to recruit enough women for a North Carolina study of midterm drug induced abortions. The reason? Potential participants strongly preferred surgical abortion. And I'll tell you why. Because drug induced abortions have a tendency to have higher there's a higher risk, in my opinion, of that woman experiencing complications. Why? Because when a surgical abortion is done, it has to be done at a clinic, hospital, wherever it is that they're doing the abortion. So it's in the setting where a doctor is present, there are professionals that are present, versus a drug induced abortion, which is basically it's a woman. She's by herself, and she's literally having to pass a fetus, a child, out of her body by herself, and it can be not only physically a violent thing, but it can also be a very emotionally disturbing experience for that individual, for that woman. And so but let's keep going. So who's sponsoring? Who's doing this? Who's doing the trial? That was my first thought. So this trial is actually being sponsored by, I don't know if I'm saying this right, Genuity Health Projects, which is a New York-based group. I did not find that surprising at all. A New York-based group who is aligned with Planned Parenthood, also not surprising. And so one of the interesting things about this is that who thought you may not believe in well, never mind. I'm going to get to that here at the end, okay? I started to wonder, how did they end up in a place like Burkina Faso? Why there? Okay. And so, you guys, this is a very, very, very long story. And so, we're trying to get to the gist of what is actually going on here. Now, the trial actually began in May of 2017 and ended December 31st, 2019. Okay. And it was conducted in 4 cities in Burkina Faso. 4 cities. Patients in the study had to be willing to undergo surgical completion if necessary, which is a surgical abortion, in the event of complications and to provide consent. Okay. We've talked about uh, misoprostol. We've talked about mifestrone. We've talked about those two drugs and what they actually do to inside of a woman's body. How one is about actually hindering uh, the development. It hinders, it kind of blocks all of the vital things that need to go to the child. It stops those things. But then the other is about extracting what is actually in the uterus. That's what those things do. And so, but it can cause a lot of issues. Okay, so there's a lot of technical stuff here that not going to get into. So let's see if I can go back to this page. No, I don't want to get into that. So, abortions in these circumstances are often more likely to lead to potentially life threatening complications for the mother, including cervical laceration, infection, and uterine rupture, or better yet, just full blown hemorrhaging, which is very possible in a place like Burkina Faso. Okay, so one of the reasons that I again, why there? So the most adverse effect, obviously, is hemorrhaging, which represented 16% of the total complications. Now, doctors within that area, um, it was interesting because the situation there in Burkina Faso at this time that they were even doing this study showed that there were currently about 100 gynecologists in the Society of Gynecologists and Obstetricians of Burkina Faso. But what's interesting is that they have one of the highest infant mortality rates and one of the lowest life expectancy rates, I believe, in the world.
Wow.
So why would you go somewhere? Um, Mind you, now, I will just say this: a leftist would gladly use a nation like Burkina Faso and say, well, they have the highest infant mortality rate in the world. Therefore, we're doing them a great service. We're doing them a very great service by coming in and making sure that abortions are available to them because obviously they're not going to be able to carry children anyway. So we're here to help. Once again, leftists come in and decide to be the savior. All right. But the problem with this, you guys, is that um, this is an impoverished nation. Okay, I believe that I believe it's like one for every. I think there's like one hospital bed for every like 2,500 people. Okay, they don't have access to the kind of tools and resources and things that are needed if a woman hemorrhages, okay, and basically bleeds out. They don't have access to blood. They don't have access to things needed for transfusions. They don't have these things for these women, and yet they chose it, you guys. They chose it to be a place where a clinical trial would be done for drug induced abortions, which produces the kind of complications that they are not prepared for. Just blows my mind. But yet people don't believe that the whole issue of eugenics is real. Why would you go to a nation like this? You guys, this is not some clinic in some study group in Burkina Faso, okay, that did this. This is literally a New York based organization that held this trial
Well,
directly connected to Planned Parenthood.
it's easy to answer why that they picked that place
Of course.
because they consider those people disposable.
Yeah.
A
The
poor
undesirables.
poor black
Mhm.
third world country,
Mhm.
people in those countries, their lives are worth less.
Mhm.
They wouldn't go to California, they wouldn't go to San Francisco. They couldn't do this in any place in America.
Mhm.
They do this because there's no FDA
Mhm.
in this country.
Mhm.
The government is probably getting money or somebody's getting money through
Somebody's being
this
subsidized
and they
for
don't
it.
and they
Yeah.
don't care.
Mhm.
So they're going to a place where there are no rules and they can just use these black people as guinea
Yep.
pigs.
Yep.
And this is shameful
Yeah.
that this is happening right now.
Yeah. I mean, I was
And
just shocked. I was shocked when I read this.
I think any other moment in time, this would be a huge outrage. And the fact that a story like this comes out and it just flies completely under the radar.
Mhm.
I mean, you have an organization going to a third world country and using people in these poor countries, people as guinea pigs.
Mhm.
I would imagine a lot of these people that are signed up to this probably are doing it for money,
Mhm.
more than likely.
Mhm.
And a lot of them probably don't even understand the contracts they signed if they did sign any contract.
Yeah.
I would imagine their legal system isn't designed to fight back or they have any kind of legal recourse
Mhm.
to fight these corporations
Mhm.
and nonprofits that are instituting this program.
Well, it's like, you notice they didn't, they didn't go to Ghana. They didn't go to any of the other, they didn't go to there's a plenty of other places that could have been chosen. Better yet, one of these drugs that's even been used was produced in France. Why not go to France?
Yeah.
Why not go to Germany? Why not go
Use
why
the
not go to
French.
Sweden? Why not go to a country that, and find a group of women that are perfectly healthy, not impoverished, probably not, may not be considered undesirable, and try it there. I just think that people really need to understand this is sinister. This is deep. This is not about women's right to
It's
choose.
amazing because it seems like liberals pick their worst
Yeah.
for minority people.
Yeah.
Anything they have that they want to do that's truly despicable,
Yeah.
they find black people to do it to first.
Mhm.
And you
And
just
that's
see
been
that,
going on for years.
yeah, you just see it throughout history with the Democratic Party.
Mhm.
At their worst, they're the victim, the number one victim of the Democrat Party has been the black people
Mhm.
of the world.
Mhm.
So I don't know if you've spoken on the supercoils or anything like that yet.
Um this was something, and this they put this in this particular article to give an example as to, you guys, the really the level of what organizations like this that are American based have done over the years
Yeah.
to impoverished nations and to impoverished women that are probably considered to be undesirable, or unable, not, poor, unable to
And that
perhaps take care of
and then that and
children.
that term undesirable, that's not something that we're just coming up with out of the thin blue air. These are terms that
Mhm.
were used to describe these
Mhm.
different people
Mhm.
by different groups who funded
Mhm.
these kind of things,
Mhm.
like the Ford Foundation and
Mhm.
groups like that.
Mhm.
They've labeled these people Planned Parenthood at one point
Mhm.
before all these groups whitewashed their terminologies
Mhm.
and switched it to where it's like, oh, now we're helping these people.
Mhm.
They used to just say they were undesirable, they were dim-witted, they were slow,
Feeble-minded.
feeble-minded. This is
Mhm.
how they describe black people. This
Mhm.
is how they describe people,
Mhm.
minorities,
Mhm.
people of color.
Mhm.
These institutions are designed
Mhm.
to eradicate us,
Mhm.
and they are doing it systematically.
Mhm.
So when they're testing out their drugs, this is some of the things they did.
Mhm.
So one of the things that they implemented was one of the things they tested, and actually it went terrible for a lot of minorities. Was
Bangladesh women is
yeah,
who they tested it out on in 1972.
and that's the supercoil.
Mhm.
And essentially, what the supercoil is it's basically just wadded up. I'm guessing plastic,
Mhm.
and they have this insertion device, and they insert it into the uterus,
Mhm.
and it expands, and they leave it in there for like 24 hours, and it's supposed to irritate the uterus, and so
But it has
whatever's in there,
razors
yeah,
attached though,
as so
all
essentially you're
over it.
just sticking a razors into
Several
your body,
razors.
several
Mhm.
razors, and
Mhm.
it just goes in there, and it just, they say,
Cuts.
irritate.
Mhm.
It slices and dices whatever might be in there, and then they
Mhm.
go in and they pull it out later.
Mhm.
This has just been horrible. And I
Mhm.
looked up, who was the inventor of this, and this is a man named Harvey Karman. Now, you won't believe this guy's backstory. And just to go a little bit into it, he was an American psychologist and inventor. And in 1955, he was working towards his doctorate in psychology. He was not licensed to practice medicine. He used a speculum and a nutcracker to perform an abortion on a woman in a California hotel room who died.
Mhm.
He was convicted of providing an abortion, which was illegal in California at the time, and he only served 2.5 years in prison.
Mhm.
He subsequently got out and he developed the supercoil, what we
Mhm.
just talked about.
Mhm.
And the technique was used to enable lay practitioners, basically people who have no experience in abortions.
Mhm.
You're supposed to be able to give them this tool and they
Mhm.
can start doing late term abortions.
Mhm.
And who did they go to first? People of color,
Mhm.
Bangladesh.
Mhm.
And they inserted in all these women and they
Mhm.
had high rates of injury in these women.
High,
Women were
high.
bleeding out and all kinds of
13,
crazy things.
13 out of the 15 women actually had to be hospitalized with very serious complications. And some of them even had to have a hysterectomy because they
And
had been so cut up
they
inside.
did another trial in the black community in
Mhm.
Philadelphia, Pennsylvania. And
Mhm.
you won't guess who was the main practitioner of this.
Mhm.
Kermit Gosnell. You might
Mhm.
remember that name. So
Mhm.
before he was famous, these liberals went to him into the black community and said, hey, insert these super quills into these black people. Like I just said before, they saved their worst for people of color.
Mhm.
So 15 women in their second trimester traveled from Chicago to Philadelphia, where Kermit Gosnell performed the abortions using Carmen's method. A public television crew from a station in New York City filmed the procedure at Carmen's invitation. 9 of the 15 had complications, 3 of those with major complications.
Mhm.
And so this man went on to invent more things for abortion. Carmen invented the flexible cannula, and I'm guessing that was something that was used around the world up until 2008. It's just this guy's impact. I mean, the things that he did tied to Kermit Gosnell. I mean, these are merchants of death
Mhm.
roaming around
Mhm.
black and brown people's neighborhoods and countries,
Mhm.
testing their wares and
Mhm.
just doing great damage to the black community.
Yeah, it's amazing. Um, and there's obviously there is so much more to this story that we really don't have time to go into in this particular session. And I will be thinking about if there's anything that I will write about this, if there's anything that I will maybe do a special video about this. But you can't read something like this and this not be heavy, way heavy upon your conscience. And I know some people want to say, well, other countries is not our business. And you're right, it's not our business. But I have a problem when not only am I trying to use the voice that we're trying to use the voice that the Lord has given us to speak out and wake African Americans up, to wake the black community up when it comes to abortion in this nation, when it comes to what began before Planned Parenthood came about, what was the real goal behind any of this. And so coming from that standpoint, and I read a story like this where women are being used as guinea pigs in an impoverished African, area in the world where they have no access to things that could possibly save their lives, is just mind blowing, and it's wrong. And I don't think that we should just sit back and just be quiet about it. I think that people need to be upset about it. I think people need to be um, questioning a whole lot of things. I pray that my pro choice friends out there would look at something like this and go, now why would they choose that? Do you still think that this is about a woman's right to choose? Do you still believe that this has nothing to do with wiping out people that are considered to be undesirables in this world? And that government, American government, has been able to control who is allowed to live and who is allowed to die for decades. And so no, that's why we will continue to do these types of stories. This will not be the last time that you hear about this, by the way. I don't know how, but we will continue to bring this up, and we will continue to dig even further into this to find out what exactly how deep does this really go? How far out does the branches of American government stretch when it comes to abortion? Anyways, guys, we're gonna wrap it up. Thanks so much for listening. You guys take care.